Welcome to Coffee with Kyle, number 12. I'm Kyle Ridgway. Good morning. Today I wanted to talk briefly on kind of a topic that I've seen gain some momentum among DPT students, among physical therapy students, but also among professionals, among the American Physical Therapy Association, even in some of our journals and publications. And it's this concept of identity, which I want to put in scare quotes a little bit because I think identity is a word that is tough to pin down. And I think I'll come back to that. But in any case, some of you are probably familiar with the concept of imposter syndrome. This has been decently well characterized in psychology. I don't know how well it's been studied. I don't have a depth of knowledge on that psychological framework. But in any case, it's kind of the concept that people who may actually be well qualified or may actually be fairly successful or contribute at a decently high level kind of feel like they don't belong, that their success is maybe accidental, that they don't know enough, that they're not as good as other people. And that's fairly common among a lot of professionals and young professionals. And I see it creep into healthcare professions at all levels from, because I work with a lot of physicians and I work with basically every type of healthcare professional, from pharmacist to respiratory therapist to nurse to other therapy disciplines like OTs and speech therapists. But in physical therapy in general, I think that kind of imposter syndrome generally within healthcare, and then combined with this kind of chip on our shoulder, this kind of, we need to prove ourselves, we're not quite good enough, this kind of attitude, these two attitudes kind of spin together, and I think they kind of hinder our ability to take on meaningful roles within healthcare. I think one of the mistakes we make is we try to either compare ourselves, our practice, or our knowledge base to physicians, and let's just call the elephant in the room what it is. Like, if you're a physical therapist or a nurse practitioner or a physician's assistant or an RT or a speech, you're not a damn physician, and that's okay. And a physician is not an NP, and a physician is not a respiratory therapist, and a physician is not a physical therapist. And the ones who think about professional roles, and my sense is even very young interns, they know this and they understand this. And so I think we're making a categorical error to try to explicitly compare our knowledge and skill set to physicians unless, and here's the caveat or the dichotomy, unless we are trying to figure out who's best suited to be in a particular role or solve a certain problem. Musculoskeletal pain complaints and musculoskeletal medicine is a great segment where that probably needs to happen a little more often. But in any case, I think that by continually trying to define our identity, to figure out what does a physical therapist do, what's the identity of a physical therapist, how do we communicate that to various stakeholders? Sometimes I think that can get us into trouble. Now, the communication to various stakeholders I actually think is important. But this focus on constructing a explicit identity where, people get frustrated that, well, man, if you asked 100 physical therapists, they'd all explain what they did differently. Well, if you asked 100 physicians what they did, they'd all explain it differently, quite frankly. And there's different specialties and subspecialties within medicine. And granted, they're more well recognized than, say, physical therapy practice. But again, as I've talked about previously, we need to broaden our lens and look more outward as opposed to inward. Of course, people are going to know what physicians and nurses do more than physical therapists. There's a whole bunch more of them, and you're more likely in your care pathway as a patient or a consumer to run into them, for better or for worse. In some situations, again, musculoskeletal medicine, that's maybe not the best, but in general healthcare, you're going to run into way more nurses and physicians just by number, and that's okay. I think we need to have a little more humility and understanding of kind of just the rote numbers in that regard. But I think what we need to focus more on is we need to focus more on understanding and speaking the same language as other professionals and understanding what their knowledge and skill set is, what their roles are, and how the healthcare system works, because then we can figure out as physical therapists, where do we fit in? Where's there gaps that we can fill? Where's there two segments that we can bridge together better? Then we can also figure out where are vacuums in the healthcare system? Where are there literally places that no one is? Or where are there new places that need to be existed or new models that we can contribute to? Trying to identify those meaningful roles and collaborating, I think, actually creates our identity for us. And I talk to younger therapists about this a lot. I say, as an individual, the best thing you can do for your profession is practice at the highest level you can, because then you are being not only an advocate, but you're being an ambassador for your profession at the patient level, but you're also being an ambassador and an advocate for your profession at the provider level, at the interaction between different healthcare providers. There's nothing more powerful than that. It's very grassroots. The other reason, when I feel like as a physical therapist that you have really kind of proven your worth or proven your expertise, is when other people start referring to you by name, not your profession. They don't say, "Where's physical therapy?" They say, "Hey, where's Rebecca, that one physical therapist that's really good? Where is Rebecca?" They're not asking for physical therapy. They're asking for that professional, that person who practices at a very high level. Some may say that maybe is degrading to the profession as a whole, but I actually think that that's a remarkable positive. And the collaboration with other disciplines is the absolute key for us to create a very well-known identity within the healthcare system, but then also with society writ large. And again, this is not an argument that we shouldn't make catchy slogans like "physical therapists help people move," which the California APTA has done a great job of. That's not to say that we shouldn't work harder to try to communicate our knowledge and skill set to relevant stakeholders such as insurance companies, research funding agencies, legislators, other healthcare professionals, hospital administrators, consumers, the public, patients, potential patients, public health groups. I'm not saying that at all. We should do that, and we should do it very well. What I'm saying is, in order to construct or push forward a well understood identity, what we actually need to do is we need to focus on, number one, having the best knowledge and approaches that we can so that we are actually science-based, effective, and aggregating information that is relevant to our field to give the best care possible. But secondarily, again, we need to look outwards to other disciplines, and we need to learn their language. And we need to make sure that we're using basic scientific and research language appropriately, and we need to collaborate with these people on a day-to-day level and at a system level. And we're only going to do that, again, always coming back to language, by understanding and speaking their language so that we can actually collaborate. If we don't use the same language, that's actually an immediate barrier to collaboration, right? If I can't understand what you are saying, you don't know what I'm saying, I don't understand what you do or your knowledge base, you don't understand what I do in my knowledge base because we use different words or we use the same words differently, there's an immediate barrier to collaboration that needs to be overcome. And I think as physical therapists, we need to be a little more humble and have a little more humility that people within healthcare maybe aren't going to understand what we do, aren't going to understand some of the depths of our training and knowledge in some cases, and that's okay. Good. It's an opportunity to build a relationship and educate. I think every interaction you have with every patient and every professional, no matter how wrong their assumptions are about physical therapy or what you do, is an opportunity to educate. And I think a mindset flip and taking that more really kind of to the grassroots level, I think will be more effective. Where I get justifiably nervous is when physical therapists continue to propagate our own language that no one else uses. And the classic example of this right now is the movement system. The APTA has come out and said that the movement system is the professional identity of the physical therapist, and that this should permeate through research, education, and clinical practice. So they've said that profoundly this should affect every sphere or every segment of the physical therapy profession. Well, this is a system that we have internally made up, that we say we're going to be the experts in, that we're going to use language around, that we're going to create diagnoses around, and that's going to be our identity. This internally focused identity construction is going to not solve any of the problems that we've identified with communication, collaboration, taking on meaningful roles, being recognized as experts in certain areas where we should be involved in patient care. I think it's actually going to worsen that. And some colleagues and I, Matt Shremba, Paul Notowski, have talked about this maybe ad nauseum on the Canadas Athletics podcast, which I will link down in the comments, as well as some of the information from the APTA. But what I'd like to maybe leave you with this morning is that when it comes to identity, instead of trying to construct it internally with new words and new systems and new things to rally behind, maybe we need to look externally and learn a little bit more about the other stakeholders who are at the healthcare table and the stakeholders in society, and get better at communicating to them, almost like we would with a patient. We don't blame a patient when they don't understand what we've said. We realize that maybe we haven't used the right words and understand their perspective and their language, and we have to retool our approach. Let's do the same thing as far as trying to construct a physical therapy identity. That's all I have for you this morning. It was good to see you. Have a great day.